بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله. I'm Dr. Hassan Razi, Associate Professor, Anatomy and Embryology. This is the second video to continue our series in the description of the body skeleton. As I mentioned in the previous video, that our skeleton is classified into axial skeleton and four appendicular skeleton, two upper limbs and two lower limbs. And for descriptive purposes, we divide each limb into four parts: girdle, proximal segment, middle segment, and distal segment. And as I mentioned, the function of the girdle is to fix the limb to the axial skeleton. So let me to apply these four concepts to the lower limb. So the first, this is the girdle of the lower limb, which is known as pelvic girdle, that is formed of these two hip bones. The pelvic girdle or the hip bone is responsible for fixation the whole lower limb to the axial skeleton. Then the proximal segment is the thigh, and the skeleton of the thigh is formed by this bone, which is the femur. And the middle segment, which is the leg, is formed by the skeleton of these two bones, the medial one, which is the tibia, and the lateral one, which is the fibula. And finally, the distal segment, which is the skeleton of the foot. So let's say to start by comparison between the skeleton of the upper limb and the skeleton of the lower limb. The girdle of the upper limb is formed by two bones, one bone anterior, which is the clavicle, and one bone posterior, which is the scapula. In comparison to the lower limb, which is formed by only one bone, which is the hip bone on each side. And the proximal segment in the upper limb is the arm, and its skeleton is formed by a humerus, while in the lower limb, the proximal segment is thigh, and its skeleton is formed by femur. In the upper limb, the middle segment is known as forearm, and it is formed by these two bones, radius and ulna, while in the lower limb, the middle segment is known as leg, and it is formed by two bones, medial one, which is the tibia, and lateral one, which is the fibula. The distal segment in the upper limb is known as hand, which is formed by 27 bones, while the distal segment in the lower limb is known as foot, and it is formed of 26 bones. And inshallah, I will explain the difference in the number between the hand and the foot. Another point of comparison between upper limb and the lower limb about the joints forming. So here we have, this is the shoulder girdle, and the shoulder girdle or pectoral girdle, as I mentioned, it is formed by this joint, which is the sternoclavicular joint, and this one, which is the acromioclavicular joint. While in the lower limb, the two hip bones, we have another arrangement. The two hip bones on each side articulate with each other in the midline by this cartilaginous joint, which is known as symphysis pubis, and the two hip bones articulate posteriorly with the sacrum to form the sacroiliac joint. Then, in the upper limb also we have this joint, which is known as shoulder joint, while in the lower limb, this joint is the hip joint. In the upper limb, this joint is the elbow joint. While in the lower limb we have this one, which is the knee joint, in addition to this bone, which is known as the patella. Here, this is the superior, middle, and inferior radioulnar joints. While here, sorry, because of that, it is broken here at this side. This is the superior, middle, and inferior tibiofibular joint between the tibia and the fibula. Here, this is the wrist joint. While here in the lower limb, this is the ankle joint. Take care about the names of the bones in the hand. In the hand, carpus, metacarpal, and phalanges. While in the lower limb, these are tarsus, metatarsal, and the phalanges. So now I will shift to describe each bone separately. These are the bones forming the lower limb. So I will start with the hip bone, so that we have the same topics or the same titles as we mentioned in the upper limb. What about the site? What about the type? General features, the site determination, and the joint formed by each bone. Let me to start first with this one, which is the hip bone. Hip bone, regarding the site of the hip bone, it forms the girdle of the lower limb, which is known as pelvic girdle, as I mentioned, which is responsible for the fixation of the hip of the lower limb to the axial skeleton. Regarding the type, it is classified as an irregular bone because it hasn't a fixed shape. Hip bone is actually formed of 3 fused bones. So first, this depression here, this socket is known as the acetabulum. And the acetabulum is the landmark for the lateral surface. And it must be directed laterally as it articulates with the head of the femur to form the hip joint. Acetabulum has the following parts. This part here, which is smooth, so this means that not all the parts of the acetabulum are smooth. Only this surface, which is bounded here by black, similar to the leonate. So this is the leonate surface of the femur. This surface, which is the leonate surface of the femur, is the only part of leonate surface of the acetabulum is the only part of the acetabulum that articulate with the head of the femur. While the remaining part of the acetabulum, which is this part, this is non-articulating part of the acetabulum, which is known as acetabular fossa. This margin of the acetabulum, this is the margin of the acetabulum, which is known as labrum of the acetabulum or lib of the acetabulum. It is incomplete inferiorly to form this notch, which is known as acetabular notch. As I mentioned, where the notch means depressed border, acetabular notch. In the bottom of the acetabulum, exactly in the acetabular fossa, we have a tri-radiate cartilage. This tri-radiate cartilage ossified by the first 10 years of life. So this tri-radiate cartilage represents the boundaries of each of the 3 bones forming the hip bone. So again, hip bone is formed of 3 fused bones separated in the early life by the tri-radiate cartilage. And the tri-radiate cartilage extends downward like this. So by this tri-radiate cartilage, or sometimes known as Y-shaped cartilage, we can bound the 3 bones forming the hip bone. This bone that is starting here from the inside of the acetabulum, all this bone is known as pubic bone. And the pubic bone forms the antero-inferior part of the hip bone. So the antero-inferior part of the hip bone is formed of pubic bone. The second part of the hip bone, which is this part is known as ischium. Ischium that forms the postero-inferior part of the hip bone. And this part, this bone, which is a separate bone, this one, which is the separate bone, that forms the superior part of the hip bone, which is known as ilium. So the hip bone is actually formed of 3 fused bone, but separated in the early life by the tri-radiate cartilage. Okay. Let me to start first with the antero-inferior part of the hip bone, which is the pubic bone. The pubic bone is formed of the following part. This is the superior pubic ramus. This is the inferior pubic ramus. And this part is the body of the pubis. So the pubic bone is formed of 3 parts. Superior pubic ramus, inferior pubic ramus, and the body of the pubis. And the body of the pubis. And the body of the pubis is characterized superiorly by the presence of this palpable bony elevation, which is known as pubic tubercle. So this is the pubic tubercle. This is the pubic tubercle. And the body of the pubis has a medial surface, which is this one. The medial surface of the body of the pubis articulate with the medial surface of the opposite pubic bone to form this joint here in the middle, which is known as symphysis pubis. Symphysis pubis. So this is about the pubic bone. Then what about the postero-inferior part of the hip bone? The postero-inferior part of the hip bone is formed by the following. This is the body of the ischium. So this part, which is the postero-inferior part, is known as ischium. It is formed of body of the ischium, and the body of the ischium has this bony elevation, which is known as ischial tuberosity, and this ramus, which is known as ischial ramus. The inferior pubic ramus together with the ischial ramus form one ramus in adult life or in adult skeleton, which is known as conjoint ramus. So the conjoint ramus, word conjoint means union or fusion, because of this cartilage in the early life will be ossified, and the inferior pubic ramus will be fused with the ischial ramus in order to form one ramus, which is known as the ischial, the conjoint ramus. The two conjoint rami, the two conjoint rami on each side will form the pubic arch. So this is the conjoint ramus of the right side, and this is the conjoint ramus of the left side. These two conjoint rami will form this arch which is known as the pubic arch. And the ischium has this spine which is known as ischial spine. So again, what are the features for the postero-inferior part of the hip bone, or which is known as the ischium? It forms, this is the body of the ischium. This is the ischial tuberosity, which is the bone for dependence during sitting. So while you are sitting, your weight is supported by this bone. This is why it is thicker than the pubic bone. And this is the ischial ramus. The ischial ramus together with the inferior pubic ramus will form one ramus, which is known as the conjoint ramus. And finally, this spine is known as the ischial spine. And the ischial spine projects in the opposite way to the acetabulum. So as I mentioned, the acetabulum is an indicator for the lateral side, while the ischial spine is the indicator for the medial side. Then, what about the superior part? What about the superior part of the hip bone, which is known as ilium? So all this bone that I'm handling between my two fingers, this bone is known as ilium. And the ilium has the following features. Number one, this surface is known as the outer surface. Why it is outer? Because it is in the same direction to the acetabulum. It is the outer surface, lateral surface, it is smooth. It is sometimes known as gluteal surface. Why? Because of the moving to this skeleton here. So this is the outer surface because it is directed towards the gluteal region. This is why this surface it is known as outer surface, lateral surface, or sometimes known as the gluteal surface because it is directed towards the gluteal region. And as I will describe in one of my lectures, inshallah, it gives attachment to the group of the gluteal muscles. This surface, which is the gluteal surface, is characterized by the presence of 3 gluteal lines. This is the first gluteal line. These lines are more or less imaginary lines, or sometimes it may be ill-defined lines. This line is the posterior gluteal line. And we have another line, which is this one, which is the middle gluteal line. And we have a third line, which is this one. This is the inferior, or sometimes known as anterior gluteal line. So these are the three gluteal lines. By the presence of these 3 gluteal lines, we can divide the gluteal surface of the ilium into 4 areas. So this is an area, this is a second one, this is a third one, and this is a fourth one. So this area is the area, this area is the area that lies behind the posterior gluteal line, and this area is the area that lies between the posterior and the middle gluteal line, and this area is the area between the middle and inferior gluteal line, and this area is the area below the anterior or inferior gluteal line. These lines have different names according to the different texts. This area is characterized by the presence of impression. This impression that gives attachment to a very important muscle. This impression lies above the acetabulum. This is why this impression is known as impression above the acetabulum. Impression above the acetabulum. This is about this surface, which is known as the lateral surface, outer surface, or gluteal surface. Then we have this one, this surface. So this is the bone in the anatomical position, and here this is the midline. So this surface is the medial surface that is directed towards the pelvis. This is sometimes known as pelvic surface. So here in this model, so here this is the surface. This is the surface that I'm talking about, which is directed towards the pelvis. So this surface is sometimes known as medial surface or pelvic surface because it is directed towards the pelvis. This surface is divided by this line, which is known as the arcuate line, into two areas. So this is, and here this is the medial border of the medial border of the ilium, and the medial border continue with the arcuate line. Divide the medial surface into these two areas. This depression, which is known as iliac fossa, it gives attachment for a very important muscle that will be described later, inshallah, which is known as the iliacus. So this is the iliac fossa. This surface is known as iliac fossa. And this is the iliac tuberosity that gives attachment to very important muscles supporting the sacroiliac joint. And this surface here, this surface is known as auricular surface or articular surface. Why? Because of this surface is for articulation with the sacrum to form a sacroiliac joint. So here, back to the model. So we have this joint. This joint is the sacroiliac joint, which is articulation between the sacrum and the ilium. So this is the area here. This is the area in the hip bone for the articulation with the sacrum, which is known as auricular surface or articular surface for the articulation with the sacrum to form sacroiliac joint. These are the surfaces of the ilium. What about the borders of the ilium? Ilium has the following border. This border, which is known as anterior border of the ilium, and the anterior border of the ilium carries two spines. This spine is known as anterior superior iliac spine. And this is another spine which is known as anterior inferior iliac spine. So the anterior border carries these two spines, anterior superior and anterior inferior iliac spines. And this is the posterior border. The posterior border carries these two spines, posterior superior iliac spine, posterior inferior iliac spine. And another border, which is this one. This border is the upper border of the ilium, or it is sometimes known as iliac crest. Iliac crest. The iliac crest, or the upper border of the ilium, has the following part. This is the outer lip of the iliac crest. This one. This is the outer lip. And this is the inner lip of the iliac crest. This one. And we have this broad area, which is the intermediate area. The outer lip carries a broad elevation like this, which is this one. This broad elevation is known as iliac tubercle. So this tubercle is known as this is the iliac tubercle, and the iliac tubercle is about 5 centimeters behind the anterior superior iliac spine. And the last border is this border, which is the medial border. And as I mentioned before, the medial border continues with this line, which is known as the arcuate line. So that again, what about the borders? Anterior border with these two spines, anterior superior, anterior inferior. Posterior border with these two spines, posterior superior, posterior inferior. And the upper border, or it is known as iliac crest, with outer lip, inner lip, and the intermediate area. And the outer lip has this elevation, which is known as iliac tubercle, and this border, which is known as the medial border. As I mentioned before, this is the ischial spine. And by the presence of the ischial spine, we have here these two notches, a greater one and a lesser one. So this notch is known as greater sciatic notch, while this one is known as lesser sciatic notch. Greater sciatic notch and the lesser sciatic notch. These are the general description for the hip bone. What about the side determination? How I can identify the side of the hip bone, if it is right or left? So again, we can apply the three fixed rules for the side determination. Superior from inferior. Superior by the presence of iliac crest, and inferior by the presence of this large foramen, which is known as obturator foramen. So again, as a warning, don't handle the hip bone like this, and don't consider that this is the iliac crest. This is not. Now you are handling the hip bone in a wrong position, because of the obturator foramen must be directed inferiorly. Obturator foramen directed inferiorly, and the iliac crest is directed superiorly. How I can identify medial from lateral? Medial from lateral by this large depression, which is known as the acetabulum, and the acetabulum directed laterally. How I can identify anterior from posterior? Anterior from posterior by the thickness of the pubic bone in comparison to the ischium. Because of, as I mentioned, the ischium is more thicker than the pubic bone, because of this bone is the bone supporting your weight while you are in sitting position. But we have another way to differentiate anterior from posterior by the greater and the lesser sciatic notch and the spine in between. So this means that the greater sciatic notch, ischial spine, and the lesser sciatic notch are directed posteriorly. So this bone is now known as right hip bone. We have a rapid way to identify the side of the hip bone. First, put the greater sciatic notch in the first web of the hand, like this. And be sure that your fingers cover completely the acetabulum. So now you are handling the hip bone by the right hand. So this is the right hip bone. If you are handling the hip bone by the opposite incorrect hand, imagine that this is the first web of the left hand, and putting the greater sciatic notch in the first web, the acetabulum is still easily seen or exposed. So now you are handling the hip bone by the incorrect hand. So again, put the greater sciatic notch in the first web and cover the acetabulum with your fingers. Now you are handling the hip bone with the right hand, with the correct hand. And finally, what are the bones forming the share with the hip bone in the formation of the joints? So the first, as I mentioned, we have here in the model, it will be more clear. So that we have this joint, which is the symphysis pubis. Second, this joint, which is the sacroiliac joint. And finally, this one, which is the hip joint.